What really causes addiction? It's a question that's been asked countless times. Many people chalk it up to a lack of willpower, to moral failings, to a person's environment, upbringing, or social circle. These are common misconceptions that have been deeply ingrained in our society, painting addiction as a choice rather than the complex disease it truly is. But is this the whole story? Is addiction merely a matter of willpower? But is that really the case? Or is there something more to it? To understand addiction, first we need to understand our brain. The human brain is a fascinating and complex organ, responsible for everything we think, feel, and do. And it's in this intricate network of neurons and synapses where the story of addiction begins. You see, our brains are wired to ensure we will repeat life-sustaining activities by associating those activities with pleasure or reward. Whenever this reward circuit is activated, the brain notes that something important is happening that needs to be remembered, and teaches us to do it again and again without thinking about it. Now imagine what happens when this system gets hijacked. Substances like drugs or alcohol or even behaviors such as gambling or eating can stimulate the same reward circuit. They trigger a surge of dopamine, a neurotransmitter that signals pleasure. This dopamine rush can be so intense, so out of the ordinary that the brain starts to take notice and begins to reduce the production of dopamine to balance out the overload. As a result, the substances or behaviors that once caused great pleasure now no longer seem as enjoyable. The person starts to need the substance or behavior just to bring dopamine levels back to normal and avoid feeling low. This, my friends, is the onset of addiction. The brain has been tricked into believing that the addictive substance or behavior is as essential for survival as other life-sustaining actions like eating or sleeping. And it's this powerful and misguided association that makes overcoming addiction such a challenge. It's important to note that not everyone who uses drugs or engages in certain behaviors becomes addicted. Genetics, environment, and developmental factors all play significant roles in determining who will develop an addiction. So, when we talk about addiction, it's not just a matter of willpower or morality, it's about recognizing how our brains respond to certain stimuli. It's about understanding that addiction is a disease, one that alters the brain in fundamental ways. And just like any other disease, it needs understanding, treatment, and compassion. So it's not about willpower, it's about how our brain responds to certain stimuli. Once the brain has experienced this pleasure, it wants to repeat it. This is the essence of the cycle of addiction. Picture it like a hamster wheel. The hamster gets on the wheel because it enjoys the sensation of running. But after a while, it can't get off the wheel. It's trapped in this repetitive cycle. And that's exactly what happens with addiction. Repeated exposure to addictive substances or behaviors sparks a profound change in the brain. This change isn't just a fleeting shift. It's a fundamental alteration in the brain's reward system, the intricate network that governs how we perceive pleasure. When you indulge in something addictive, whether it's a drug, alcohol, or even a behavior like gambling, it amplifies the pleasure signals in your brain. This intense pleasure, in turn, conditions the brain to want more of the substance or behavior that caused it. But here's the catch. Over time, as the brain becomes accustomed to these heightened pleasure signals, it becomes harder to feel pleasure from other things. The things that once brought joy, like spending time with loved ones or engaging in a favorite hobby, no longer seem as enjoyable. The brain, in essence, becomes rewired to crave the addictive substance or behavior, creating a vicious cycle of addiction. This cycle doesn't just stop at cravings, it also leads to continued use or engagement in the addictive behavior, even when it has negative consequences. The brain's altered reward system trumps rational thinking. People with addiction might recognize the harm they're causing to themselves and their loved ones, but the overpowering urge to satisfy their cravings often overrides this understanding. This explains why someone might continue to use drugs even when they're losing their job, their health, or their relationships. It's not that they don't care about these losses, it's that the cycle of addiction has taken hold, and breaking free from its grip is no easy task. And that's the crux of the matter. The cycle of addiction isn't just a series of bad decisions or a lack of willpower, it's a brain disorder, a complex interplay of biological and environmental factors. This is why breaking free from addiction is so challenging. So, how can we treat addiction? Well, it's important to acknowledge that addiction is a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequences. It's not just about willpower, or moral failure, or lack of discipline. This is why treating addiction is more than just stopping drug use. It involves long-term, often lifelong management of the disease. Addiction treatment must address both the physical and psychological aspects of the condition. On the physical side, there's detoxification, which is the process of clearing drugs from the body and managing withdrawal symptoms. For some addictions, medications can be used to help re-establish normal brain function, curb cravings, or block the addictive effects of drugs. But let's not overlook the psychological side of addiction. This is where therapy comes in. Cognitive behavioral therapy can help individuals recognize, avoid, and cope with the situations in which they're most likely to use drugs. Motivational interviewing can enhance people's motivation to change their drug-using behaviors. Family therapy can help resolve issues at home that may contribute to drug abuse. And then, there are support groups. These are communities of people who have experienced addiction and are on their journey to recovery. They provide a space for sharing experiences, challenges, and successes. They remind individuals that they're not alone and that recovery is indeed possible. But here's a key point to remember. Treatment is not one size fits all. What works for one person may not work for another. Each individual's treatment plan must be customized to their specific needs and circumstances. It may involve a combination of therapies and services, and it may need to be revised over time as those needs change. This is why it's crucial to have a comprehensive understanding of addiction, its causes, its effects, and its intricacies. By understanding the science of addiction, we can develop more effective treatments, tailor them to individuals, and ultimately, break the cycle of addiction. Understanding the science of addiction can help us develop more effective treatments and break the cycle of addiction. So, what have we learned today? Addiction isn't simply a question of willpower or morality. It's a symphony of complex factors, a dance between brain chemistry and behavior, each feeding and amplifying the other. Treatment isn't a one-size-fits-all solution, but a multifaceted approach that addresses both the physical dependency and the psychological roots of addiction. By understanding the science of addiction, we can better support those struggling and work towards more effective treatments.